Wonderful. Well, hi, everybody. We'll get to introductions in a second, but I'm Kiki. We are here today to do infant and early childhood mental health office hours with you all. Our time together today will start with some welcomes, some background. We're going to share about infant and early childhood mental health at HCA, all the things that we've been up to over the past 2 years. And then we hope to have at least some time at the end for open floor community updates from you all. So if there's something that you've been working on the past few years that you'd like to share with the group, something coming up soon, that'll be the time for that. And also to share that if you have questions during the meeting, please drop them in the chat. We'll be paying attention to that and we can either pause or come back to the questions depending on what they're related to. And I will pass it to Christine to introduce herself.
Hi, everyone. Good to see you. I know lots of you. Christine Cole, for those of you I don't know, she, her pronouns. I work with the wonderful Kiki here on all things infant and early childhood mental health at the Healthcare Authority, which is our Medicaid agency. And just for folks that I don't know as well, before coming here, my work has all been in primarily direct practice, doing the good work that a lot of you do, and now getting to translate that into policy work. I'll hand it back to Kiki.
Well, hi, everybody. I'm Kiki Fabian, also work at Healthcare Authority. Unlike Christine, I don't come from a clinical background, but I love all things program evaluation, technical assistance, and community engagement. So I'm really happy to be here with you all. And I'll be celebrating my 5-year anniversary at HCA this September. So just really amazing how the time flies. And some folks have already started to do this, but we're really happy to see all of you today. If you don't mind introducing yourself in the chat, we'd love to see who's here, your name, your role, your organization. If there's something you're hoping to get from today, or you're looking forward to today, or if you have an update to share during our open floor time, we'd love to know that as well. Well, let's go ahead and get started with some background. Christine and I always love to provide background to really understand the context of the work that we're doing, the people that have come before us that have visioned these ideas, and all of the different factors that really influence the work that we do. So I wanted to start with some important background about MACI. MACI is really the major project that Christine and I have worked on in our time at HCA. It's really focused on mental health assessments for young children, but it's been the starting place for a lot of other amazing work as well. And so we just like to make sure that people know about this really important policy in our state that for Apple Health or Medicaid, we allow reimbursement for multi-session assessments, for provider travel to home and community settings, and a requirement for providers to use the DC 0 to 5. Now, even though that policy was really focused on assessments and it was signed into law in 2021, it's really informed a lot of the ongoing work that we've done over the past few years. Little timeline to show how things have happened at a slow, steady, maybe developmental, you could say, pace of starting to offer DC 0 to 5 trainings, of publishing the crosswalk, surveys, and then our statewide tour that we'll tell you a little bit more about on the next slide that informed our priorities that we published back in 2024 in the winter. And then today, really what you're going to hear is how we've continued to work on those priorities over the past few years. But we want to give a special shout out to the statewide tour. This was a project that we went around to all 10 regions of our state, and we met with infant and early childhood mental health providers to talk to them about what's working well, what's still challenging, what they still have questions about, how HCA can help, and how our community can really come together to support this work. We got to meet with 96 different mental health providers from 53 organizations, generating almost 2,000 quotes. And all of this would not have been possible without the partners whose logos you see on the screen. So pulling off in-person events that bring people together is no easy feat. And we just want to express our gratitude to all of the organizations here who helped make that possible. So if you're one of those organizations, please know that we are grateful for you every day. And the work that we do could not have happened without these sessions. from a
Keep going, Kiki, and
oh.
okay. Awesome. So like Kiki shared, we went around the state, we heard from a lot of you, and we tried to take what we heard in terms of best practices as well as challenges and needs to help us to think about what are some of the areas that we could prioritize and focus on at HCA. As many of you know, it is helpful to have things that are kind of guideposts and put down in writing to say this is the thing that we're doing and that we're focusing on. And while we know that these different areas certainly can cross beyond the early life period, they also are really important that we say these matter to us when it comes to the perinatal and early childhood population. And so our priorities, and we share the updates that we've grounded them in these priorities. So starting with workforce, thinking about accessible access, moving into how are things informed by the community and people like the statewide tour, thinking about how data can help us to make value-based purchasing choices and payment choices, and then really thinking about the collaboration and coordination. And that aligns pretty well with the themes that we heard on the tour. So we'll give you some updates and we're going to do some gratitude as we go. For priority one around strengthening and supporting a diverse workforce, we first wanted to celebrate that one of the key things with the mental health assessment for young children policy was getting folks trained up in the DC 0 to 5 and making sure that folks who are not doing diagnosis and assessment but our allied supportive professionals know about this work. And we've had a huge amount of folks with 670 mental health professionals being trained. I'm sure that's more now, Kiki, and 450 allied professionals. Thank you to the Center for Early Relational Health and our DC 0 to 5 trainers and the Regional Steering Committee for helping to elevate and support this work. We also have a huge group of folks participating in CPP. We've been able to partner with the Perigee Fund, and the Barnard Center is doing a lot of coordination for us. Thank you also to our CPP trainers to help get folks supported in being able to offer CPP across our state. We have way more folks than we did before, and we've also been collaborating with folks from our Evidence-Based Practice Institute at CoLab to help folks with evidence-based reporting. And Kiki's really been partnering with our managed care orgs to make sure that things actually work right when we say that we're doing this work and that we're billing for it. And we also have the opportunity to work with oriented towards treatment at this time. We hope to keep growing in kind of that continuum of care. We've had just ongoing updates around what it is that we already cover and allow through Medicaid, and we've been releasing new guidance. Thank you to a lot of the folks on the statewide tour, but in particular, our uh, pregnant and parenting women providers who ask really good questions about how we incorporate infant and early childhood mental health into those settings and how we help ensure that folks get compensated for that work. And special shout out to some of our HCA colleagues, in particular, Sarah Pine and Ashley Pena, who support those populations and have helped us to make sure that things make sense for those people. We also are working on currently how we clarify who caregivers are when we talk about caregivers as a part of treatment and caregiver only sessions, and also kind of diving deeper into how do we do these multi-session assessments when we might be collaborating with early intervention. And so more to come, things coming soon. And we also have had the opportunity to collaborate across our state with our sister state agencies around how do we make sure these referral pathways make sense for folks who are in child welfare, pediatrics, early intervention, and also with our Within Reach, who hosts our Help Me Grow in the state. And so lots of intersectionality happening of how do we make sure that when folks have needs, they get connected to care. I think the other folks that we wanted to say a huge thank you to as we've been brought into the early childhood court space, which is our Safe Baby Team approach in Washington. And we also have a couple folks here. I think Nooch is here. I'm not sure if Maylene is, who are helping us to develop a referral and care coordination training to help our allied professionals to know when and how to support folks in a meaningful way and getting connected to care. I think I covered everyone, but I'll keep going, Kiki, unless you stop me. Around building person and community-centered services, I think the biggest thing is thank you to all of you who were a part of the statewide tour because that's really been the cornerstone of us making sure our work is guided and informed by the work that you all are doing in practice. We have so many people to thank around this work, in particular our tribal partnerships. We have folks in HCA at the Office of Tribal Affairs, but we also have partners like one of our DC 0 to 5 trainers, Catherine, Zach from Colville, Colwitz Tribe, who's invited us, DCYF's tribal consultation work, and Don Yazzie. All of you have really been incredible in inviting us in to really think about how we bring this information into tribal communities in a way that honors and centers the wisdom of tribal communities, and really challenging Kiki and I to think about how we adapt what we're doing to make sure that it makes sense for how the system works for Indian Health Services and tribal communities, because it doesn't always work exactly the same as it does everywhere else. And so we're excited to continue to dive deeper and to continue to learn from and with you all. Especially the folks at the American Indian Health Commission who have also been inviting us in too. Was learning from each other. During the statewide tour, we heard again and again that folks learned the most from understanding how other agencies and providers are tackling sticky issues. And folks said, we want to do more of that. And so now we have quarterly. Kiki has really been a leader. Sorry about the recording, everybody. Kiki has been a leader in us having a newsletter that goes out. And this has been a beautiful example of ways to keep folks informed, but also of collaboration. Many partners from across our state who offer programs and do great work that is state funded and supported have been a part of highlighting their work. Again, there's a lot of people to name, so I'm not going to list them all, but programs and partners, thank you for helping us to build awareness of the work that you're doing and help us build bridges and connections. Kiki, anything to add? So folks are going to get tired of hearing from Christine.
Nothing to add, but I am working on putting some of the names of the people who contributed in the chat. So sorry for
Thanks,
a little bit of
Kiki.
the delay.
No worries. Put you on the spot there. We also this year have been working around value-based sustainable infant and early childhood mental health payment and systems. This is one of the things that I think is the hardest to wrap our heads around. And so it is a slow process, but one that we learn new things all the time. A huge shout out to Kiki and our partners in our Medicaid programs division in collaborating around how we build up our managed care partners' capacity and competence in this space, but also how we strengthen our contracting language to really support and promote young children and early life programs. This year, we have new language added to our contract, which I'm super excited about, that defines what our early intervention program is and why it's covered under our Medicaid program. We also have language around strengthening the information that goes out to providers about infant and early childhood mental health. And I know that this will just continue to grow, but a very special thing because I think this is an area that feels so hard to understand at times and sometimes feels like such a simple thing, but can be really powerful when there's something written down in the contract to say this matters and this exists and this is available to you. So thank you, Kiki, and our partners in MPD and our MCO partners, of course, too. This slide, I think, also is a huge celebration. Kiki has been leading our work and doing a claims analysis, which I know does not sound the most exciting, but it is a way that we can document and say what has changed in our billing and reimbursement practices since we implemented the mental health assessment for young children policy. And so, really taking the advocacy and the implementation and then saying this is the impact and using that both to celebrate what has changed and the influence it's had, but also to say, where should we go next and where do we need to continue to lean in and strengthen what we're doing? So, thank you, Kiki, and our partners at the research and data analytics team in the state. We also have some data folks here at HCA that are huge helpers in helping us make sense of all of this stuff. And then the last piece, we are continuing to charge forward on alternative payment models. This is the biggest head scratcher because it sounds simple and yet it's so hard. We are continuing to partner with folks at CoLab, and we are starting to explore partnerships with the Washington Study. I'm going to get it wrong, the Washington State Institute for Public Policy, to continue to kind of explore what are some of the common elements, what is the benefit costs of these different infant early childhood mental health programs, to have a long-term goal that we have a special way to pay for infant and early childhood mental health that's more reflective and aligned. We heard time and time again on the tour that this is a really challenging area for this field and that this is a really big desire. And so while it is slow, we are continuing to check it off and learn more as we go, and we will keep you updated as we learn more. I promise you won't have to keep me hearing me talk. I only have two more slides and then we will open it up for all of you. Uh, our priority number 5 is around cross-system alignment. This is really acknowledging and honoring that this work does not just live within Medicaid, it also does not just live within the behavioral health system. But when we think about infant and early childhood mental health and early life, we are also thinking about our early learning folks and our child welfare folks and our perinatal folks and our pediatric folks. And so we know that kiddos do not exist in a vacuum and there's no such thing as a baby. And so this is just continuing to develop relationships and connections in hopes that things work better. We have been very fortunate that lots of folks from across the state are willing to hang out with Kiki and I on a monthly basis. That we said, hey, everyone who is interested in working on pregnancy, infancy, and early childhood, do you want to come hang out with us so that we continue to learn from each other and understand the work so that we can try and make it work better? And we've had a ton of meetings where we've really built greater connections, but also just better understanding of how all these different pieces work together. So thank you to all the sister state agencies, internally and externally, who keep hanging out with us on a monthly basis, and to Kiki for really leading us through that work. We also want to say a huge thank you to the 0 to 3 folks and the other states who participate in the Finance and Policy Project. For those who don't know, there was a group from Washington who participated in an earlier cohort, and that's really where the beginning of the mental health assessment for young children policy work began. And we have continued to feel just incredibly supported and held by that group as Kiki and I learn how to work in this Medicaid system and state system, but also how do we continue to build off the work that's happened and folks that are here. I know Evelyn, Andrea, and Catherine are all here. You all continue to help us by sharing what you're doing to help us to know how we can do better work here in Washington for the folks that we're trying to support. So huge gratitude. And then we also have a whole bunch of early childhood convenings that I cannot list all of them right now. But thank you for inviting us, and thank you for continuing to wrestle with hard questions with us about how we make things work. A lot of providers have continued to tell us both on the tour and since then, things just don't always make sense. I hear this from HCA, I hear this from somebody else. And so we just are really grateful for the folks that are willing to think together about how we make things work better at a systems level for hopefully that parallel process and ripple effect that things make more sense for providers and family. Oof, one more slide. I promise we're almost there, guys, and you won't have to listen to me anymore. The last piece that we just wanted to highlight is while Kiki and I, our charge has been around infant and early childhood mental health. We all know, again, there's no such thing as a baby, and that perinatal mental health is incredibly important and is another area that often needs additional attention and support. And so we have been embarking on some different ways to support perinatal mental health in our work. We have a workforce survey that I hope if you haven't filled it out already and you're a mental health therapist in Washington, you will fill it out to help us to know who is serving folks in this space and what are the challenges that you're having. We're continuing to lean in around how to build awareness of Medicaid coverage after pregnancy and folks' experiences around the care that they receive in the perinatal period. We're doing more fun claims analysis to try to make sense of are things as expected with our perinatal mental health services and where might we need to lean in and strengthen our policies. And coming so soon, I think in the coming weeks, like so soon, we will have some perinatal mental health toolkits to support folks in their communities to be building awareness around perinatal mental health and specific topics. And these are based on the North Carolina Matters toolkit. So thank you to them for letting us kind of rebrand them for Washington. But special shout out to Alicia from First Step Family Support Center for giving us the opportunity to partner with you to bring those toolkits to our state. We feel very fortunate. We also just want to say thank you to our sister state agencies like Department of Health and our HCA partners within Reach Help Me Grow and the Perk Center at UW for helping us with all of these different pieces to kind of try to expand our work in perinatal spaces. Whew, I think that's about all of it for me. Those are our updates to you about what we've been working on. And our greatest thank yous again to all of you for your support and help in making this happen because all of these pieces do not happen with Kiki and I alone. And now we are to the part that we're most excited about, which is that we are hoping to turn it over to all of you to really hear what's happening in your communities or what are the even challenges that you're still facing that you're hoping that we will kind of think about together. And so we put this in the chat. Well, I can put this in the chat around what's been happening at your organization for the past 2 years. Where are you feeling excited? Where are you feeling stuck? And also, you can just choose your own adventure because, sometimes you have things to say that have nothing to do with what Kiki and I prompted. So, with that, Kiki, anything you want to say before we open the floor?
I don't think so, but we've already had a few people comment that they'd like to share. So I think I see that we don't have emojis available on Zoom. Maybe that's just on my side. So I was hoping we could use the little raise hand emoji if you'd like to be able to share. But if other people are struggling with that, I might see, is Nucha available to share his update first? Oh, then it was, okay, it is working. Perfect. Go ahead, Nucha.
Hi, thank you very much for the opportunity. Just wanting to let everybody know have begun recruiting for the fifth cohort of the ACT program that's going to launch in April of 2026. We're doing a number of outreach presentations and information sessions, and the flyer I just put into the chat are the locations currently. We're thinking that we might still add a few more in different locations and regions around the state. And if you haven't had a chance, please do visit our website. You can sign up for open houses there. It's a brand new website. We just redesigned it. And it's pretty and it has lots of information that you can use. And if you need anything, please be in touch. I'm happy to support anybody that's interested in the program or in anything else around infant early childhood mental health, prenatal to 5 work. Thank you.
Awesome. Thank you so much, Nucha. And yeah, Nucha, you already got a lot of gratitude in our presentation for all the work that you do in our state. So we could not do this without you. And I can see that the raise hand emojis are working. So if you have an update and I may have missed it in the chat, you can use that. But I know that Meg McNulty has an update to share. Meg, are you here and ready to share?
Here, maybe not ready. This is like such an amazing morning to see all the wonderful faces and what a powerhouse and a group convened here. My name is Meg McNulty, and I have the privilege of serving as the ED of the Center for Early Relational Health, which does statewide work and is essentially now the WAME, the Association for Infant Mental Health here in Washington. So if we don't know each other, if you're not on our newsletter, I'm going to put the way to know about our newsletter in the chat. And want to first thank Kiki for your fearless leadership, intentionality, and thoughtfulness in this work. So much of the workforce development that happens in the state happens because of HCA, and specifically Kiki, it's been fun working with you. And shout out to the DC 0 to 5 trainers and the Workforce Collaborative folks and steering committee on this call. It's been a fantastic year. A lot of you know that we launched the center officially last August, and just want to highlight two quick things. First is, if you haven't heard about a Circle Time series that we're starting Circle Time next week on July 30th, and the topic will be around birthing justice. It's a free session. There's their CEUs. We do not have merit hours yet. We will for August, but please join us and bring your, as we keep saying, bring your sippy cup. Matt, it's midday, and it'll be a monthly series. And we also are having a community conversation next month on August 27th around the Latinx refugee and immigrant experience. It will be conducted in Spanish with translators to English. There'll be two channels where you can either again here in English or in Spanish. And then finally, again, this is a powerhouse. There's so much great work going on in the state. We like to really think that we say, like, it starts with connection and then it goes to community, and this is a community. So if you want to be part of a newsletter, we have, highlights where we highlight a person and the work they're doing. We also do, sharing good news. I know we're going to talk about challenges, and I could probably talk about those the rest of my time, but just please share in your exciting news or share in the great work you're doing. People are very leaned in, and as you said earlier, Christine, want to be more connected and want to know more about what's going on out there. So I'm sure there's plenty more to say. We are doing some revamps to the DC 0 to 5 Workforce Collaborative work, and if you want to hear about that, I'm super excited about some of the changes that we're making. So just wanted to say hi, and thanks again.
Thanks so much, Meg. And I guess this is something we could have shared earlier, but we are hoping to have more DC 0 to 5 trainings starting this fall. We were a little bit on pause with all of the budget shifts that are happening in our world right now and contracting delays, but so lucky to continue working with the Center for Early Relational Health and really looking forward to more DC 0 to 5 trainings this fall. If you're looking for DC 0 to 5 training and you need help finding it, you can always reach out to one of us, put your name in the chat, let us know that you need help connecting with that, and so excited to continue that work in the future. I see that Jess Howard from the Therapy Fund Foundation has an update to share. Jess, are you able to share?
Yes, hello, good morning, everyone. I'm so happy to see everyone's faces. I may have seen some of you at the behavioral health conference that we hosted at Lumen Field this past Friday. It was we had a keynote speaker, Dr. Jennifer Mullen, who spoke on decolonizing therapy and really tapping in and tuning into our ancestral practices. But I really came on to also share that we were funded a youth free therapy program for any King County residents ages 13 to 24. And I put the application in the chat. If you have any questions, I'll also put my email down. It's jess@therapyfundfoundation.org. If you have any questions or have other ways that we can partner or collaborate, I'd love to hear from you.
Thanks so much, Jess. It's really exciting. I love Jennifer's work, and really exciting to hear about the updates that are coming soon.
Yeah, absolutely. Thank you for the time.
Okay, I see a hand up from Arbinda.
Yes, thank you, Kiki. I am Arvinda from Dad's Move, certified peer coach, work with caregivers. And I have shared the flyers on a group chat. It's about the Fathers United Weekend. It's from September 12th till 14th. If you're interested, you can register for it. It just allows the caregivers to little time away from everything, kind of decompress and get back to your family with more rejuvenated and more, with a better insight, talking to other fathers. And it's with the intent to help fathers, reconnecting with others. So yeah, let me know if you have any questions. I also will add my email in there. That way I can even send you what every day may look like from September 12th till the 14th. And thank you, Kiki.
Well, thank you so much for being here and for sharing about that. Dad's Move has been an incredible resource to the community, and making sure that dads have support is just so important for children's mental health. So appreciate you sharing that opportunity and making that available to folks. Oh, okay. I see a hand up from Monica Oxford.
Hi, everybody. Oh, what a great group. Thanks for inviting everyone. And it's so nice to see so many familiar faces. So I just wanted to mention, I'm putting it in the chat. I think Nucha also put it in the chat. We had the People Powered Workforce Initiative over the last year. We did our release of our report in June. If you go to that website, it's pretty interactive. You can learn about what we learned from providers all across the state, similar to the statewide tour, just hearing the voices of providers and elevating the issues and concerns and needs, as well as the solutions. So the solutions that were generated out of the Proviso People Powered Workforce, we are kind of translating some of that work now this summer into more clear strategic language that we will be using to advocate for the workforce. And I think if you just go to the website, one of the really clear messages, one of the clearest messages was the need for reflective consultation across all disciplines. So not just therapists, but providers and home visitors and pediatrics, and the need to build relationships and to feel supported within your organization, to have safe and secure relationships in organizations and have that supported by reflective consultation. So that was a really clear message that came through, and just really appreciate the people who contributed to that. Over 114 voices of providers, and just sharing their really felt lived experience. So I hope you can visit the People Powered Workforce and take a look at the website. The report is in report form. There's a PDF that you can download, but you could also just kind of float around the website as an interactive tool. I also want to mention, I believe this summer, Nucha put in the Barnard Center website. So if you are interested in CPP, CPP is now on that website. And so we will be updating it, but you can learn about open houses that might be coming up over the next several months as we look to get funding for the next cohort. And really important that even if you've already been trained or you're not interested in being trained, that you share this out with other people. We really want to get this across Washington State in all communities. And so it's really important that we together share out that information. So if you hear of someone who's interested, please direct them to our website. And I think that's it.
Thanks so much, Monica. And yeah, just wanted to say that the People Powered Workforce website is so fun to explore. You all have made it so interactive and easy to find the information and learn more. So appreciate you all doing that and making sure that there's ways for people to engage with information in lots of different ways, because we all learn differently. All right, I think Christine put you on the spot, but you're down for it. Jennifer, are you able to share some updates from the Skagit area?
Good morning, everybody. I'm just so amazed at this group of people. It feels so good to be in all of your company today. And one of the things that I'm most excited about, and I see that Liz Cooksey is present today, our Help Me Grow system locally recently launched, well, I guess about a year ago, a little over a year ago, a newborn outreach approach that's very much informed by perinatal and infant early childhood mental health trying to have kind of a proactive opportunity to meet families at the birth center in a very welcoming and inviting sort of way so that they know that there's a community that is here to support them. And Liz has just such a beautiful presence about her. She's been blessed to work with Monica and her team to get some really great training and support. And we're hoping to build that out. I would love to see that spread across the state. We're working with our regional partners where the neighboring communities are also supporting us with some materials to provide to their residents who birth in Skagit County, because about 30% of our births are from people that reside in other counties that occur in Skagit, and then about 30% of our families birth in other counties. And I just think it's so important to reach people across the board with a normalizing message about how much support there is for parenting and how important their role is, regardless of how people are entering into that phase of their life. Liz, is there anything that you want to share about your work?
No, I mean, thank you for what you already shared. I feel really honored to just be here this morning, listening and learning from all the other amazing things happening in the state. But we've been at this for a year, and it's really been beautiful to watch the hospital staff start to really experience the support of this as well. So it's not just the families we're building relationship with; it's also a way of starting to support the staff to think in terms of what happens when families leave the hospital, right? And to move out of the medical model into a more relational model has been a really part of the rewarding aspects to this work. So yeah, but I would love to talk more about it, but I don't want to take any more time right now.
Well, thank you both. It's really special to get to hear these regional updates too, because Christine and I do a lot of work at the state level, but often what's happening within these specific regions is just as or even more so important. So thank you both so much for sharing. And speaking of regional updates, I think Ramyana is here and able to share some updates about the Spokane region.
Hi. Thank you so much. And it's just so I haven't stopped smiling since I joined you guys. Like it's just seeing friends. It's amazing to be part of this community. So some updates from Spokane. You probably those who've talked to me or Jen know the Hope fever we have. So Hope stands for healthy outcomes from positive experiences. And it's a framework that we've utilized in the last, I would say 4 years now in Spokane. And we made it big, guys. Finally, we were able to find some funds, and with the support of a local foundation, we trained now 40 facilitators in Hope, which means that they can go out in their own communities and make Hope their own and present and implement, with our support and organizations. But through the years, now we were trying to count how many people we've actually trained, presented to. It's more than thousands for sure. And continued, to take this approach of like, cross collaboration and including folks from all the different fields in mental health and social service and public health and healthcare, in focus really on perinatal and 0 to 5 periods. But we've used the framework to develop a social connection learning series. So how people access, positive experiences, not just through, in the childhood, but also through the lifespan, and how that strengthens the social connections in the community. So focuses on Spokane. We highlight local work from different organizations. We invite local speakers. So that's really our hyper focus, is just what is happening and what works locally. So we will be entering August 27 is the last fourth series from the 0 to 5 period. And then we're going to be moving to K to 12. Similarly, again, we're going to be meeting quarterly. And each time we meet, we focus on the building block of hope and how access to that block strengthens social connections. We're going to move then to adults and then older adults. And we're going to circle back down to perinatal and 0 to 5. So that's a continuous commitment we have from the Regional Health District and NACAN and the School of Social Work at Eastern and Launch Northwest. So we are through the Innovia Foundation. So we are making sure we continue with this series, not just for the learning, but really for the networking and the support that folks can provide to each other. So that's where we at. Like Spokane's going to be the first hope-informed city. Watch it happen. I'm manifesting it.
Well, thank you so much, Rumiana. You have been an incredible partner to us. And just thinking about our time together, Spokane was I think Spokane was the first place that we did a visit of the statewide tour. And what a wonderful way to start off this initiative. Thank you so much for spreading hope everywhere you go. Going to give it a little pause if there's anyone who is thinking and considering, maybe I want to share, I'm not sure.
Can I share just out loud? My name is Julie Dalen, and I'm from Wahkiakum County, far, far away from anyone. No, we're pretty small. And I know I've been working with Chris DeRozier as me, the provider person, and her, the supervisor. And I don't even know if this is the right place to say it, but we successfully did an assessment and treated our first 0 to 5 person this last quarter-ish, several months. One. We had our one, I think she was 3, delightful child. And I had the privilege of working with this child and her family as our very first to like launch our program here in Wahkiakum County. So I just felt so blessed. Anyway, she's graduated there. The family has successfully met their treatment goals, and they're on their way to have a great life. And so I just wanted to share that.
Julie, that is
I feel all teared
the
up too.
perfect thing to share. And yeah, just so wonderful to hear that it's just a
I was
huge
hoping Chris
accomplishment.
DeRozier, I was hoping she'd be on the line and go and jump in and help rescue me, but she didn't. So
You were brave and you stepped up. And yeah, I remember us meeting with Chris 2 years ago for our visit out to, I think we were in Aberdeen. No, where were we? You might have to help me, Christine, but we were somewhere out there.
Somewhere out there. I don't remember. Somewhere over closer to the coast. I think we might have
Yeah.
been, we weren't in Hoquiam, but I feel like we were maybe near Hoquiam. Aberdeen?
Yeah.
Hoquiam? I don't know.
And hearing Chris talk about how this was the vision to make it happen, and so you've made it happen, and thank you for sharing that very hopeful story with us today, Julie.
Oh, excuse me. Hi, this is Rosalind, and I have just a basic question. Right now, I'm not working on anything. I've just been keeping up with the different actions that you guys have done. I tend to pass on the information as resource and try to make those connections with the community that I interact with. But I do have a question. I'm wondering who is working on BIPOC issues directly, especially in the realm of trauma. But I'm just wondering who's working on that directly. Is there anyone?
Looking out to see if there's anyone in this room today that could connect with Rosalind.
I appreciate it. Thank you.
Rosalind, are you looking for specifically like clinical services or just generally working on BIPOC issues?
To be quite honest with you, I am in the midst of preparing a research study on the influence and necessary connection for Black mothers to come back together and uh, help and aid the family. So there's a piece of what is out there that's specifically for how the help coming for Black females, right? In the birthing process, from the time that they understand that they're pregnant, throughout that whole process. And I say this because of my personal experiences. When I I am an older woman, but when I had my children, my firstborn, he's in his late 30s, um, they could not tell me what my child would look like if it choked, right? The color differentiation, everything was based on a Eurocentric realm. And then when I had a set of twins, about 21 months later, I had the same issue. When I had a daughter 8 years later, there was still that issue. So there really wasn't real support for me, knowledge that I can go to, asking those intimate, personal questions. Um, and so I'm when I talked to my daughter, who has now a 4-year old, I hadn't heard that too much changed for her, but they did talk about the different color. But my granddaughter is lighter, so you can tell if something's going on with her. So I was just really curious how we've evolved, where that is. There's trauma behind that. So I'm looking at the whole spectrum, anybody in that area from birth to grave, to be quite frank with you. I like to put together a little network.
That sounds great. I think there was some information in the chat. I'm putting my email address, or if you want to, you can email me, or you can provide your email address, and I'll reach out to you. But I know of somebody that's working with a collaborative of Black African American mothers in South Seattle. They're nurse practitioners, and they're supporting that community around the perinatal mental health services. So I can definitely connect you with those folks.
Okay, I'm going to put my information in the chat. Um, and yes, because it's probably easier for you guys to, find me than for me to write down all the emails.
Yeah,
And
Rosalind, be
Rosalind,
careful what you ask for. You got a lot of partners who are excited to work with you in the chat.
Oh no, I'm good for it. I'm good for it, and it excites my heart, my soul, to be honest with you, because I still run into people of color, and they're lost on some issues. And since I've kind of waned out of that the past 5 years, 6 years, I don't have any answers for them, and I'm seeing more and more coming up where they're actually discussing their issues, their problems, their traumas. They're trying to raise their kids, trying to break cycles and all this kind of stuff. And where do they receive support? Where's their arcs of safety? Um, you know, anyone who looks like them, because sometimes entering in, you need that familiar face, not that it's a familiar person, before you go out into the rest of the community and you can, glean from the knowledge of others, who don't look like you. So those are the bridges I'm trying to make. And um, yeah, hopefully I'll get this research set up and find somebody to help me with it. So
Rosalind, I'll connect you with our Spokane folks here, the Shades of Motherhood Network. But just to highlight their work, it's a Black-led organization that started first with training doulas, Black doulas, to serve the Black community in Spokane. But they grew just immensely over the last 2-3 years in their work of like really looking at the continuum of support. So very similar to what you're talking about. They run the Melanin Moms support groups. From them, also in their training, they branched out with Locked In Fatherhood, which is like a just Black, again, Black-led organization just for Black fathers to provide support for each other. Just like issues around parenting and being Black, especially here in Eastern Washington, that comes with its own challenges. And now they're partnering with Providence Healthcare to provide childbirth education classes to the community with what community wants to hear, about childbirth. So they're very oriented around not just healthcare, but also social service, mental health, and trauma and healing. So they'll be awesome to talk to see what they've been up to here in Eastern Washington.
thank you. Yeah, no, that's is excellent. That is excellent.
And
Thank you.
Rosalind, I'm happy to take your email address, and if you're interested, introduce you to one of our assistant professors in the School of Nursing. a Black woman doing exactly that research on pregnancy and birth outcomes for Black women and the kinds of traumas and experiences around that. So she does community-based research. So I will connect you with her.
Oh,
Dr. Kaboni Godway.
that sounds familiar. Is she with the University of Washington?
Yeah, University of Washington School of Nursing.
School of Nursing.
Oh, do you know her?
I think I've heard in one of my psych classes, I think she came and spoke to us at one point, or I heard her speak on somewhere. I don't know if it was video or on campus. And I'm in Tacoma, so the Tacoma campus.
Oh, awesome.
This
Well, I'll get your email and make a connection.
perfect. Thank you so much. And if anybody knows in the realm of autism and access for Blacks, and that's on a personal level. I have a couple kids that my own personal grandchildren who are in that category, and it's a little bit of a struggle. So I'm gonna stop talking. Thank you.
We can connect, Rosalind. I did get back to you. I have my hands on quite a few things, but one of them is the ECHO for UW, which does ASD and IDD. They're opening up a complex care one very soon that I'm going to be a hub team member on, to kind of bringing in that 0 to 5 lens, as well as a trauma lens that we don't consider. But that is a very good place to bring a lot of these questions and connections. The UW team is there. There's many people across Washington on that team that give a lot of feedback, not just to our people that don't look like us, but also BIPOC families across the board. A good place that I've been connected with has been our health district, with the maternal health, with the focus of African American mothers, which is where I've been doing some of my work. And then my research is on the same thing for my dissertation, just about how intergenerational trauma flows through mothers to their children, and what interventions can we utilize as therapists that reflect the African American mother experience, to better utilize interventions instead of trying to make us mold to a box that does not fit us. So I would love to connect with you.
Thank you. There's so much in here. I can't copy all this stuff down. And right now, when I get really excited, I can't see. So please do, Kanisha, contact me, everyone who's involved, who want to. I bless you. Thank you. I honor you, and I appreciate you for reaching back out to me. Thank you.
Well, what an amazing note to wrap up today. Rosalind, thank you so much for asking this question. Thank you for this amazing community for leading in with so many different offers of support, raising up different organizations that are doing this work. This is exactly what we hoped might happen by pulling this group together today. So thank you, thank you, thank you. And I saw the comment in the chat, is there a way we could publish the amazing transcript? We're going to work to make sure we can try and download the chat before we leave today. Christine's been taking some notes, and so we'll try to compile some of this information to send out to the folks who are here today. But we will also probably keep this room open for a little bit longer than normal if there's something you need to copy from the chat before you head out, just in case we have technical difficulties on our part. That can always be a good backup plan. Christine, anything before we officially end for today?
Kiki, this is Marilyn from the Universal Developmental Screening Program at DOH, and I know we're wrapping up, and I'm going to make this really short, but I'm so glad you spoke up, Rosalind. I did want to share with everybody on the call that the Developmental Screening Program, and I'll put the website in the chat, we have resources around developmental screening for children birth through 5, so they get screened ahead of school. Public school, and we have a data system where parents and healthcare providers can enter and access information on the results of a child's screening. And we have a brand new dashboard that we're going to be launching probably within the next month. We're in the final stages of testing it, and then we're hoping to do a couple of pilots so that early learning and early, childcare sites can also access it. And Rosalind, I just want to speak to some of the issues that you raised, because when we were developing this, we actually contracted with King County Best Starts for Kids to work with Black and African American caregivers to get their input. And one of the things that we found just resonated in terms of some of the studies that I've read of actual research, where the exact same behaviors in a Black child can be diagnosed very differently than in a white child. And that intersection between mental health and a child's development, like, does this child have a speech disorder, or is a child traumatized and afraid to speak? And the screening tools that are on the Strong Start include the MChat. You mentioned autism, so those early signs of autism, so that they don't just get referred out for being a discipline problem when the issue is actually autism. Anyway, I'm going to drop the link in the chat, and my email as well. So feel free. And also, I wanted to quickly mention Kendra Liljenquist at the University of Washington got some federal funding to, I don't know how that's going now, and I do want to check in with her. But she was concerned about the fact that a lot of developmental screening tools, some of the questions on them and the scenarios described don't really resonate with Black families. And so she was developing a developmental screening instrument that would be for the Black and African American community. So anyway, those are just a couple of things. And I know I said I would be short, and I don't know how short that was.
Thanks, Marilyn. I am vigorously trying to screenshot the chat in case Kiki and I have problems with download, but I just wanted to say, I know we're at 12:01. If folks want to stay to try and capture the chat yourself, please feel free to do so. I know some folks have hopped already. I think the only thing I'd say is just thank you, everyone, again, for your ongoing partnership and commitment to this work. Kiki and I are very fortunate to have all of you as part of our community, and we truly mean it when we say this couldn't happen without all of you. So that's all I would say, Kiki, before we wrap.
Awesome. Well, if you had a great time today, we will do these office hours quarterly over the next few months. The next few will probably be a little bit more focused on mental health assessments for young children, but we still really welcome everyone to join us and come be in community together. And so we really appreciate you all being here. I'll put the link to our newsletter if you'd like to sign up for updates in the chat. And we will hang out for a couple more minutes after the end of the hour, just in case you have anything else you want to catch up with us on. But thank you for being here, everybody.
Kiki, what I'm going to do is, because it's a lot of stuff, information, if I'm just going to wait for you to be able to do a printout or something, and send it to me. And then also for them to contact me directly, because there's no way I can do, and I'm so grateful to do all of this. And thank you. This was fantastic.
Wonderful. Glad that we could help provide a space where all these people could connect with you.
And Rosalind, I wrote down your email already, and I am trying my best to get screenshots of all the things, and so would be more than happy to pull together something for you, because I have no idea how anyone would capture all of that in the time that we had. So we'll make sure we connect you, and that folks know how to reach you if they didn't get your email.
Okay, thank you, Christine. I appreciate
Of
it
course.
very much.
Of course.
Okay. Thank you, ladies. Bye now.
Nice to meet you,
Rosalind.
Yes.
Alicia, your beautiful face.
Hey!
You're still recording, so I'm like, oh my gosh,
Here, we can pause the